How precise is colectomy surgery for diverticulitis? Imagine a surgery that can significantly reduce the chance of your diverticulitis coming back. Colectomy, which involves removing part of the colon, is often used to treat recurrent or complicated diverticulitis. But just how accurate and effective is this procedure? Let's explore what the science says. When performed electively, meaning planned in advance rather than as an emergency, sigmoid colectomy has shown to be very precise in preventing future episodes. Studies show that after the surgery, the chance of diverticulitis returning drops dramatically. Within the first year after surgery, recurrence rates are usually between 6 and 11%. Over 5 years, this can increase to around 12 to 15%. Long-term data even shows that after 15 years, only about 2% of patients experience a recurrence. This is a big improvement compared to conservative management, where the recurrence can be over 50% within 3 years and over 60% within 5 years. The way the surgery is done also influences how precise it is. Laparoscopic surgery, which uses small incisions and a camera, tends to have better outcomes than open surgery. Patients who have laparoscopic colectomy experience recurrence rates of less than 3%, compared to nearly 10% with open surgery. Additionally, laparoscopic procedures have lower mortality rates, meaning fewer patients die from the surgery. The type of connection made after removing the diseased part of the colon also matters. Primary anastomosis, where the two ends of the colon are sewn back together immediately, has a lower risk of death and complications compared to Hartmann's procedure, which creates a colostomy. Hartmann's is usually reserved for emergency cases or very complicated situations and carries a higher risk of mortality. Of course, no surgery is without risks. The overall complication rate after colectomy is around 32%. This includes infections, bleeding, leaks from the connection site, injury to nearby organs, blood clots, abscesses, and sometimes issues with bowel control. The risk of death from the surgery varies but is generally between 2 and 18%, depending on the approach and the patient's health. Despite these risks, many patients find that surgery improves their quality of life. Studies show that those who undergo elective sigmoid resection often experience fewer symptoms and better overall well-being within a year. Laparoscopic surgery, in particular, has been linked to significant symptom relief, with fewer persistent abdominal issues compared to conservative treatment. Timing and patient selection are key. Not everyone with diverticulitis needs surgery. About a quarter of patients with a first episode may require surgery if their disease is severe. But many patients who recover well from initial episodes, even complicated ones, may not need surgery later. Younger patients tend to have higher recurrence rates, so their surgical options might be considered more carefully. Long-term data supports the idea that colectomy provides durable protection against recurrent diverticulitis. While some patients may still experience future attacks, the overall risk is much lower than with non-surgical management. When performed with the right technique and at the right time, colectomy can be a precise and effective way to reduce the burden of this condition. Remember, every patient is different. It's essential to discuss your individual situation with healthcare professionals who can help weigh the benefits and risks of surgery. They can guide you toward the best decision based on your health, age, and how your disease has progressed.